not the letters behind my name, it's the knowledge in my head, right? The
That's
people
right.
that I've worked with. And by the way, I've been very blessed. I would say because I've been able to work with some of the people I've been able to work with.
And all right, so that I kind of want to go a little deeper into you and into you, but also your practice and how unique it is, because your practice for people who are natural healthcare providers, for people who are chiropractors, for people who understand and recognize that there's a functional nutritional approach to life, that nutrition brings with it a whole host of benefits, and that's something that your practice has really been on the forefront of. Tell us a little bit about your practice, and I think it's important to mention the volume of work that your practice does and why that's important.
Well, it started as a solo practice, as you know, it was just me. And using the methodology that I put together, I call it the Turnpaugh method only because I don't know what else to call it. So put together a methodology to look at the body as a whole, how the body's functioning, what may be altered or off, and then how do we go about kind of correcting that and fixing that. That's kind of the big 80,000-foot view. From there, we started getting sick people well, and we started getting well people weller, even though it's not a word, better. And so improving their health, improving their function, not one piece at a time, but globally. So not one variable, one manipulative, one isolated, double-blind, placebo-controlled, one variable. We're doing multiple variables at the same time, because that's kind of how life works. You don't manipulate one thing at a time. I would frequently talk about when you drive a car, you don't listen and then shut your hearing off, and then see, and then shut your eyesight down, and then put your foot on the gas pedal and then take it off, and then turn the steering wheel. Everything has to function together. It's multimodal. Everything works together. So that's not how the human body works. It works together. It doesn't work one system at a time. So looking at that global approach, and then working with patients, and then realizing there's an unbelievable need that people are searching for to get well and stay well. So from there, I worked long hours, but I still had a long wait list, 2-year wait list to get in, which is not a badge of courage. It's a badge of we're not helping the people that need help. So we started to reach out. And since the time, fast forward, we now have 11 providers in our office, seeing over 100 new patients a month, every month, with many different health concerns, from I'm pretty healthy, but I want to stay healthy. I'm 55, I want to be healthy when I'm 85, to people coming in saying, I've been everywhere and I don't feel good. So I did it a while ago. About 4 years ago, I did the statistics. The average patient coming to see me, I was the 12th doctor. They'd seen 11 other physicians. And other doctors are not stupid. They're not. They didn't get where they are, but it's the breadth of knowledge and what you see in your office and looking at it a little bit critically different. So we were able to do that. And because of that, it actually increased or accelerated my learning, because I don't think that I have it all figured out. So I was able to now look at 11 different providers bringing me information. Anything that wasn't understood came to a roundtable discussion. We discussed it. I was usually the escalation clause. So they'd bring me a case, say, I don't know what's going on here. You figure it out. And then I had the benefit of 10 other providers bringing me cases. We're the largest draw center in the state of Pennsylvania that's not a hospital. So we do more blood than anybody except hospitals in the state of Pennsylvania. So that gave me a tremendous learning opportunity, with breadth of knowledge from breadth of labs to see what's going on.
Incredible. And it's funny, sometimes the word science is used in a very general way. And a lot of people think doctors are scientists, and they're not. And one of the things I always say is a scientist's job is to be completely detached from their outcome. A scientist's job is to actually come up with an idea of something they think is true and to do everything in their power to be wrong.
Right.
That's what a scientist does. Doctors have somebody in front of them saying, I don't feel good. And the doctor cannot be detached from that outcome. So just they're completely the opposite. And the doctor is heavily invested in the outcome of that patient. So doctors are not scientists, although they are informed by science.
Correct.
And I love that about your practice. And I've spent time there. And one of the best statistics I pulled out of your office the last time that I was there from, I think one of your office managers had mentioned that 50% of the people who come to your office have to travel over 2 hours to get there.
Correct. Still a correct statement. Yeah.
Yeah, and that's absolutely remarkable, and it's a testament to what you guys are doing. But it's